Many dealing with chronic anxiety, depression, and even conditions like bipolar and schizophrenia pass through a treatment funnel of sorts before arriving at something that brings relief. For some, their needs are met at the top of the funnel through mainstream offerings like antidepressants and psychotherapy. Others go deeper into the funnel, perhaps over the course of years, before arriving at fringe ways of understanding mental distress and treating it that bring relief. Advanced or targeted nutrient therapy is one such fringe dweller treatment that is bringing relief to many, especially those with severe anxiety, depression, mood swings, and other mental distress caused by loss of zinc, vitamin B6, and other key nutrients. In short, these people have pyrrole disorder or pyroluria, and it's often mistaken for major depression, bipolar disorder, and in some cases even schizophrenia. Returning guest Dr. Jingduan Yang has seen strong results treating patients with pyrrole disorder and related nutrient imbalances. Board certified in psychiatry and integrative medicine, Dr. Yang's treatment system encompasses modern medicine, traditional Chinese medicine, including acupuncture, and other modalities. Welcome to Vital Signs, where we learn how to get healthier from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendan Fallon. Dr. Yang, always great to have you join us on Vital Signs.
Thank you for having me, Brendan.
Before we start talking about pyrrole disorder, I'd like to go a little broader and look at mental health and how it relates to nutrient deficiency or excess in general. In terms of anxiety, in your practice as a psychiatrist and integrative medicine doctor, how often would you say that in terms of anxiety, nutrient deficiency or excess is relevant?
Well, I would say it is a fundamental factors. And anybody who went through medical school and studied biochemistry know that everything the brain produce, actually the body produce, involves the cofactors, involves enzymes, involves a lot of biochemical components that we call them nutrients. That actually is biochemicals of the human body. And therefore, for example, in the process of neurotransmitter production, you involve the biochemical process called methylation, for example. And this entire methylation cycles involves vitamins, minerals, and amino acids, and even fatty acids. So those are, we call them a nutrient. To me, they are biochemical medicine. So if you ask me, anybody who suffers from depression, anxiety, or anything that involves body or brain, when we look at the biochemical level, we have to look at nutrients.
Could you give an example, Dr. Yang, in terms of a chronic mental illness where a nutrient solution could bring significant relief?
So going back to the topic you were trying to set up for our audience about the kryptopyrrole disorder, again, for audience, you may not know what kryptopyrrole is. Let's start by explaining what it is. It's actually a metabolite from the hemoglobin. You know, our red blood cell dies every 120 days. So every time the body will break them down, and some of the metabolites, like the kryptopyrrole, which is harmless, useless, just will leave your body through urine. Okay? So most of us will be fine. We produce a certain amount of it, and it will leave our body. We're not even aware of its existence. That's why you never heard about it. However, there are certain population, for whatever reason we may not always know fundamentally, they're producing larger quantity of kryptopyrrole. In other words, every time they pee, they get rid of a more kryptopyrrole than average people. Why is that a problem? Because kryptopyrrole, as we know, is harmless, useless. To get rid of more or less, it should be okay. But the one reason it is not okay, because the kryptopyrrole binds very tightly with vitamin B6 and zinc. That means every time we pee, we lose a little bit of B6 and zinc. If it's a small amount, we're okay because we're constantly eating food that provide B6 and zinc. But for people who produce large quantity of it, most likely from the time they're very young and for a long time, because nobody ever thought about it, nobody ever looked at it or tested it or even aware of it, then imagine the body and the brain has been constantly missing B6 and zinc. Why is B6 zinc so important? If you look at the biochemistry textbook, each one of them involving more than 300, biochemical process as a cofactors. And that is critical for our body to produce neurotransmitters, for our immune system, for our heart, for our gut, you name it. It's a critical. That's why we call them vitamins, and that's why during the COVID, zinc is so important, right? And if you look at neurotransmitters, the B6 is critical for the brain to produce them. If we are losing them constantly every day without knowing it, imagine how much health impact they're going to have on us. So these symptoms is not just one kind. For example, clinically, we have we can almost tell if someone suffers from kryptopyrrole disorder even without testing, because they have a very typical clinical manifestations. For example, they have a very low tolerance to stress. They're emotionally liable and all over the places because everything depends on what's going on from outside. They're very active. And so their mood is all over the places. And they're tired during the day. They have a little bit more energy at night, so they're night owls. And they feel nauseous in the morning. They tend to skip breakfast. They stay up late. They sleep in. And also they have skin conditions like eczema. They have autoimmune disease like thyroid problems, joints, muscle issues. And they have sensitivity to auditory or visual stimuli, so light and sound. And they can be very paranoid. In a severe case, they can be even delusional. And they have trouble focusing, concentrating, and so on and so forth.
Some of these symptoms you described, Dr. Yang, would often be interpreted as major depression or generalized anxiety. Is it these physical symptoms that give the hint that it is pyrrole disorder and the sensitivity?
Yes. Yes, and these people come in with all kinds of diagnoses: bipolar disorders, major depression, ADHD, borderline personality disorder, schizophrenia, schizoaffective, and all kinds of things. Nobody really paid attention, or very few people actually think about maybe there is underlying biochemical imbalance that contributes to a critical nutritional deficiency, and that we could address. If you don't address this, no matter what medication you give the patient, it's not going to work well. So that's why I'm not saying the kryptopyrrole overproduction is a cause of all these mental health problems, which is very complicated. But it could be a contributing factors, make these people's life 100% more difficult. We do the kryptopyrrole test on everybody. I have to say between 50 to 70% of these people suffer from, if not more.
You said 50 to 70%?
Correct.
Of people coming in with depressive symptoms, with anxiety symptoms?
With all kinds of symptoms coming to us. And that's how high it is. In my clinical practice, of course, it's not the general public, because people come to me, they already suffer from problem. Not only suffer from problem, they suffer from problem, everything else are not helping. Otherwise, they don't come to my clinic. If medication solves their problem, they wouldn't show up. If the talk therapy helps them, they don't show up. They're coming because they have such a complex of mental, neurological, and physical problems. And I can give you a couple of examples.
Could I just ask first, Dr. Yang, what does the test, the kryptopyrrole test, involve?
Well, kryptopyrrole test is very simple. It's just a urine test, and we collect the urines, and we ship to a lab, and the lab we're using is called the DHA lab in Chicago, and they're doing the testing, and they tell us whether it is within normal range. You can almost predict that person might have a pyrrole disorder.
Could you give an example of where you've had that suspicion that someone has pyrrole disorder and how that's panned out?
One patient who come in and is 9 years old and suddenly developed the anxiety, intrusive thoughts, and imagings that brutal things happening to his parents. And things that's so scary and so ugly to the point he didn't want to tell anybody what comes to his head. He developed insomnia, the attention deficit and restless, and he rocking in my office back and forth and shake his legs all the time, and extremely anxious. So he was seen by different pediatricians, child lesson psychiatrists, and all that, being diagnosed with ADHD, OCD, and even schizoaffective disorder, and so on and so forth, and put on all kinds of medications, and which only got him worse. And he came to us because his football coach come to us for acupuncture, and brought him in, and we did the tests, and together with tests for methylations, for other toxicities and inflammation markers, and so on and so forth. And one thing come prominently is his pyrrole level. His pyrrole is over 90. 1 to 10 is the optimal, and 10 to 15 is a borderline, and anything above 16 is abnormal. And he has a little bit of methylation issue as well. The major issue was the pyrrole.